Hey, Mr. Speaker, sir, I thank you. Mr. Speaker, sir, I was listening to Senator Bishiro Halaki, and she was speaking to what this government ought to be listening. I want to equate her speech with one legislator in the US who was able to move and push the surgeon doctor, or what was his name? The surgeon director in the US to ensure that every American got free testing. Because, to be honest with you, this is not a disease that you can easily just say, with that forehead thermometer, that Sakaja has coronavirus. It is a disease that you cannot. No. Let me just say. Let me qualify my statement. When we walk into this parliament, Mr. Speaker, sir, you know, the surgeon at times outside, you know, point the forehead thermometer to our head, and if the temperature reads 37.8, we are taken into self-quarantine, and some might even assume that Olekina has coronavirus. Mr. Speaker, sir, this is an issue which, of course, we should not panic about it, but we should also be very, very careful. In terms of testing, I would like the current minister, whom I really respect, because for once, I want to say meritocracy is at work. It has fully worked in this country with the appointment of former Senator Mutahi Kagwe. Because when he speaks about what his ministry is doing, as a Kenyan, you feel confident. So, Mr. Speaker, sir, what I'd like to encourage the CS of Health is to try and push so that every Kenyan can get free testing. We've always been complaining that the Ministry of Health is given a budget equivalent to 5 counties. It is about time now we see the money in the Ministry of Health being used to support those poor Kenyans who cannot be able to get access to even the 19 Rand kit or the actual test kit that Senator Halaki is talking about. Mr. Speaker, sir, I'm worried about the economy of this country. Because, you know, in this country, we must have a perpetual motion machine. We buy. When we buy, we spend money. Those who need the money use that money to pay salaries. What happens when we have a complete government shutdown? What will happen to those people who are working, who cannot be paid by the government as we are paid? So, Mr. Speaker, sir, it is an important thing that we must consider. And that is why I was asking earlier on, do we really need a complete government shutdown, or do we need to be able to be proactive so that everything we make is perpetual? It is something which will be able to help this country. Mr. Speaker, sir, I'm concerned about the social effects, stigmatization. You know, when you self-quarantine, as now what we've been told by the minister, is that it is mandatory. Because he said the Public Health Act is in effect on quarantine. But what does it really mean? I'm told that our colleague from the other house who traveled abroad has been sent home to self-quarantine. What happened when Honorable Kenan now goes home? Will he sit down in the same house with his kids? Will he be able to go and set a small room out there? What about his psychological effect? There are serious things that this government should be telling us on how they are preparing Kenyans. The issue of our social gatherings. Mr. Speaker, sir, I had the Council of Governors chair talking about suspending all mortuary operations. So which means now psychologically and socially, Kenyans are affected because there are those who value their last rites. So this is a very serious issue that we need to be able to deal with it seriously. So, Mr. Speaker, sir, this motion is timely. It is timely because it gives us an opportunity to go think, look at what the government is doing, you know, consider whether it is for the benefit of our people. When I go to Narok tomorrow, Mr. Speaker, sir, the first thing that I'll do is to ensure that I look for volunteers who are trained, health practitioners, so that we can be able to go to the markets, use these sanitizers. If we cannot afford them, get a soap so that it does not affect our perpetual motion machine. If a Maasai cannot be able to go and sell a cow, where do you expect that person to be able to get food? If another Kenyan cannot be able to go to the market and sell some linen, where do you expect them to get food? So, Mr. Speaker, sir, this is an issue that all of us here should be very, very serious about. And the national government must now think seriously. And that is why earlier on, I was actually even sharing it with my colleagues and saying, Article 58 of the Constitution, really, once we amend the Constitution, we must give the president enough powers. This House has not been given a role to play when it comes to declaring of a state of emergency. You know, we cannot just be rubber stamping things, yet we are supposed to be representing counties where they make up the huge population of this country. So, Mr. Speaker, sir, as I support this motion, I think it is important for us to really think critically about even the prisoners. Because the prisoners, they are held in one area. I heard the president giving directive, Mr. Speaker, sir, of schools to be closed. What about prisons? What about those officers who work in prisons? Should they also be confined in the prison centers so that they are not in touch with the outside world? You know, because if that's not taken into consideration, Mr. Speaker, sir, what will happen is that we may end up sentencing those poor Kenyans who committed a crime. You know, we might end up killing them. So, Mr. Speaker, sir, as I support this motion, I hope that Parliament and also the Parliamentary Service Commission will now sit down and seriously think and say, as another arm of government, what are some of the things that we can do to ensure that this country progress? I like what the Americans did. When the US president signed the executive order, it suspended the operation of certain laws and gave the CS in charge of, or the secretary in charge of health, more powers to be able to, you know, circumvent the rule of law and ensure that certain things are done to help that country. That is what we should be talking about in this parliament. We should be making sure that we help our people. I support.
Okay.